everyone. My name is Emma and I'm the Senior Clubs Coordinator for ActivateUTS, so I help manage MedSoc. Before we begin, I'd just like to do an acknowledgement of country. So I would like to acknowledge the Gadigal people of the Eora Nation, upon whose ancestral lands our city campus and our homes tonight now stand. I'd also like to pay respect to the elders both past and present, and acknowledging them as the traditional custodians for this land. I will now pass it over to Daniel from MedSoc. So yeah, Daniel, do you want to take it away?
Hey guys, first of all, huge welcome to everyone who's come today. So this is actually our first online event. I'd like to say huge welcome to all our guest speakers. So we've got, just ask everyone to speak up and say hi as we kind of read you out. So we've got Zoe, she's our orthoptics student. She's going to be one of the speakers. We got Domenic, he's our exercise physiologist.
Hello.
We got Rebecca, she's going to be our genetic counselor.
Hi.
We got Nathan Halliday, so he's our physiotherapist. If you guys have any questions, we're going to have a Q&A session at the very end of the session. So if you got like kind of a bit more individualized questions, make sure to hold on to them. But if we're speaking along and you've got something that might be relevant to a point, make sure to drop in the comments. We'll have a look at it, or we'll go back to you at the very end. So first of all, huge welcome. Thank you all for coming. Hope everyone is safe and well. Yeah, let's get right into it. So our first question, we're just going to go around the circle. So we'll start with Domenic. He can respond first.
Great.
Can you tell us a little bit about yourself and what field of work you're in?
So I'm an exercise physiologist. I currently work at 4D Health and Performance in Spectrum Healthcare. Along with the exercise physiology department, I do a fair bit of corporate wellness and corporate health. One of our main partners at the moment is ASICS Australia. We're out there kind of twice a week doing that corporate wellness, and then also look after the strength and performance department of our industry. Business, sorry.
Okay, so can you tell us a bit more, what is actual exercise physiologist for some people who...
So an exercise physiologist, a good way of looking at it, we use exercise and different types of modalities to treat, whether it be soft tissue and musculoskeletal injuries into genetic injuries or illnesses, right through to metabolic conditions and so on and so forth. So yeah, using exercise and exercise-based prescription to provide care.
Okay, that's perfect. So why did you actually choose this career?
The truth is, I was a failed athlete. I attempted to play professional rugby league for a long time. And towards the end of my career, I was quite interested in this part of it, the performance part of it, and was lucky enough at the time, the NRL actually started to provide assistance for young players to go to university. And one of the senior members of the club pointed me towards exercise physiology. And yeah, I kind of never really looked back.
It's very interesting. Thank you for that. So let's move on to Rebecca. So your mic's currently off. Yep. So can you tell us a bit about yourself and what is your career choice?
So I am a genetic counsellor, and for those of you who don't know what a genetic counsellor does, basically genetic counsellors work across all sort of subspecialty fields of medicine. So we work within cardiac services, neurogenetic services, obstetric services. And basically what we do is really provide information to individuals and families about genetic conditions that they might be at risk of. We might facilitate genetic testing, so investigations, and then provide management advice. Genetic counsellors also provide a level of emotional support and I guess practical support as well. So I'm a genetic counsellor at the Royal Hospital for Women in Randwick, and I work within a maternal fetal medicine department. So this is a role where I'm just a standalone genetic counsellor working with obstetricians and midwives. And before that, I worked in a more general unit working in pediatric genetics, neurogenetics and cardiology. And I've worked at the Royal Hospital for Women, Royal North Shore Hospital, and then in Royal Hobart Hospital in Tasmania was my first job. So, yep, range of roles.
Oh, very, very extensive. So why did you actually choose to go into genetic counseling over, let's say, a different career?
So I have an undergraduate in science and then also education. And I was a school teacher for a couple of years, and I'm not a very good school teacher. And I was missing the science aspect of it. And I heard about this career and saw that there was a course. So I applied the day after it closed and got in, and yeah, here I am. So yeah. And yeah, haven't looked back like Domenic. Yep, love it.
And definitely doing very well for yourself. So yeah, let's move on to Nathan. So can you tell us a bit about yourself and what your career is?
Hi guys, I'm a physio. I've got a master's degree, a postgraduate master's degree in sports physio. So I'm an APA sports physiotherapist. I own a practice, Sydney Sports Physio and Rehab. Quite a unique sort of practice in that we're actually inside a private hospital. So my practice is located inside Lakeview Private Hospital in Bella Vista. So we have sort of a unique sort of environment where I work really closely with about 16, 17 orthopedic surgeons. So we're on a level 1, which is all the consulting suite. So that's where I've got, I guess, my practice, big gym. We've got access to a big hydrotherapy pool. And we work really closely with all the doctors and all the rehab patients sort of upstairs in all the wards. So we're kind of quite blessed that I have a real passion and background in sports physio. So we treat a lot of football players, athletes, right from Olympic athletes through to sort of the everyday weekend warrior. But we also, you know, we run day programs for falls and conditioning for the elderly. We do a lot of rehab programs for people that have just had hip and knee replacements. So we're sort of got a real scope of patients that we see. And yeah, it's a, you know, I love what I do, and we're quite lucky to have that going for us.
Yeah, definitely. If anyone's looking for a physio, Nathan's helped me out a lot. Would recommend. So can you tell us, why did you actually choose physio? Like, especially since you've got quite an extensive background in other fields of sport. And
yeah, it's funny. I actually feel it's probably one of those careers that it probably chose me, in the fact that I probably, like Dom, used to play a bit of footy, not league. I used to play a bit of AFL, and I think growing up through the system as a late teenager, I actually spent a lot of time at the physio. I'm not a massive fella, so I was always injured and getting hammered by the big guys. And I spent a lot of time through sort of 17, 18, actually just going to the physio. And I could see that they were helping me. We'd have some fun. They would have a laugh. We'd be in the gym. It would be always a bit of a hoot when you're at the practice. And I was kind of like, this looks like a pretty good career here. Like, these guys are having fun. You know, they're getting paid well, I'm sure. And to be honest, that was what it was. I think it was actually being able to see it firsthand and seeing the difference that they could make to me. And, you know, I still remember some of my younger physios when I was young, and you know, they helped me get through, you know, a lot of injuries. So it was probably something that's where I felt like I went, yeah, this is something I could see myself doing, and pursued it. And then lucky, you know, the pathways just fell into place. You've obviously got to get accepted, get to uni, and then everything flows from there. But that's kind of my initial introduction to the career, was just being exposed to it a lot, I think.
Thank you very much. So we'll move on to Zoe. So you're actually doing a master's degree, not yet in the field. So can you tell us a bit about what is orthoptics and why you chose to use it?
Orthoptics is to do with the eyes. So ortho is straighten and optics is eyes. So it's the straightening of the eyes. So basically orthoptics started as people and ways to kind of treat people with eye turns. So people who have like lazy eye and all of that kind of thing. So that's kind of where the profession kind of started. So anyone with like eye turns or just anything kind of funky with their eyes. But then now we've also kind of moving into the kind of more ophthalmic space of things. So kind of like eye diseases, your age-related things like cataracts, macular edema, and like anything neurological. So if you have strokes and stuff like that, your eyes can have all sorts of problems due to kind of, it gets everywhere in the brain. So there's lots of things that can go wrong with them. So orthoptics is kind of, depending in what kind of area you go into, you have a lot of kind of like control over a patient and kind of how to help them with their like eye turns, or you also kind of do a lot of testings and work alongside ophthalmologists. I basically did an undergraduate degree in medical science. Had the original idea of going to medicine, but obviously along the way I was kind of like, oh, is that really what I want to do? Is that gonna, you know, can I do all that extra study? And then I just kind of went along to one of the postgraduate kind of info nights, and I found orthoptics, and I'm quite glad I have. It's basically, you know, it's a 9-to-5 job. You do get that kind of like patient interaction, which I was kind of after with medicine. And it's not as kind of niche as you'd think, because you think the eyes and you think, surely there's not that much you can do with the eyes, but I'll tell you what, there's a lot that can go wrong with the eyes, and there's a lot of areas, you know, you can go into it as broad or as specific as you want, which is kind of exciting. So I also don't feel like I'm going to be stuck with just the eyes, because, you know, I can go into that even further and be like, well, maybe I just want to do glaucoma, or I want to do low vision, or, you know, so there's a lot of kind of room to move, which is really nice. And it's a growing field, so jobs, which is exciting as well.
Okay, thank you very much. So let's just move back into the same order that we just asked those questions. What did a typical work week and day look like for you? I guess pre and post coronavirus restrictions. So Dom?
Yeah, I do quite a bit of traveling across a few clinics, but normally being exercise based, we can start early. So the earliest we'd probably kick off is about 5:30. And then that unfortunately means sometimes we finish around 7:30. 8 would be the last after a class. So normally, yeah, unfortunately, sometimes it's around, on average, probably about 6-7 o'clock till about 5 to 7 at night. And that's, yeah, so they can be long days.
Very full on, yeah. So what about like nowadays? Because obviously there's a bit more travel restrictions and all that.
Yeah, luckily enough, just particularly with exercise physiology, for those that might have been on the call before, even, and Nathan mentioned, it's quite hard for hands-on physical practices to occur at this time, where for an exercise physiologist, particularly with our work cover space, where working with people that are very low capacity as it is, that work's actually significantly increased, because not only for health benefit, they need to move, but also mentally, it's really important that they maintain, and I'm sure you all heard the benefits of exercising on mental health. That's been a huge thing. So it was a worry at first, but although our gym-based and our athletic performance-based work and our general mechanical rehab has probably dropped a little bit, the online telehealth around work cover has picked up dramatically. So luckily the hours are pretty consistent at the moment. So still working consistent hours, but just more of a press towards telehealth and online sessions than in the clinic.
Yeah, that's great. That's really good to hear that you're still going. So what about you, Rebecca? How is your typical work week looking?
I work part-time, so I work a 7-day fortnight at the Royal Hospital for Women, and then I work 1 day a fortnight at UTS, doing some lecturing stuff. But at the hospital, basically it's sort of 8 till 5, but generally a little bit over that each day. And there's generally patient contact every day, so there'd be a couple of patients every day. I see a number on my own, but genetic counselors work quite closely with clinical geneticists. So these are doctors who have studied genetics. So genetic counselors are not doctors. So allied health professionals, as this is a forum for. So we do work quite closely with clinical geneticists, and we'll run a lot of clinics together in those roles, I guess I act as a little bit more of a supportive role in terms of maybe with the supportive counselling or facilitating testing and everything, whereas the geneticist will do a little bit more of the, I guess, diagnostic assessment of patients, so physical examinations and everything like that. And so, yeah, I would see probably 10 patients, maybe a few more on average each week. And then a lot in the fetal medicine department, I guess a lot of things come up unexpectedly in pregnancies. So there's a lot of urgent referrals that we need to see for high-risk pregnancies. But genetic counselling is a lot of meetings, reviewing cases, reviewing old cases. It's a lot of paperwork and admin. And so there is all the boring stuff as well. And now during COVID, a lot of the genetic counsellors in other services are working from home, but I have been, I guess, fortunate enough to be able to go into work still, because I guess we're still seeing women coming out of ultrasound scans and things like that. So I've been doing a bit of face-to-face and a bit of telehealth as well.
Yeah, that's great. So Nathan, how about you? How did things look before and after COVID-19?
Yeah, so typically as a physio, a lot of our work week is structured around, I guess, what time of the year it is. So in winter, we're heavily involved with winter sport. So I know our typically, you know, a bit like Dom, first patient in my clinic is at 7 a.m. So we're sort of getting here around sort of 6:30, 6:45 to sort of get set up and get going. And then our last patient is at 6:30 at night. So we would do, typically my guys would do 2 long days a week. So sort of 2 12-hour days and then a couple of half days in there. We have one of my guys would go to football training sessions during the week. And then on the weekends, we would go to the footy game. So we would basically be there in a physio role, sort of strap pre-game, treat the injured players, do some soft tissue stuff and sort of preparing them. And then obviously you're monitoring them during the game and be there as in a role of a physio during the game to sort of assess any injuries. So, and then you're basically starting that process when all the injured players on Saturday, Sunday, they get injured, you're preparing them, booking them in for Monday, Tuesday and planning their sort of weeks ahead. And, you know, planning whether they need x-rays, MRIs, do they need to see the surgeon. But typically that's our, you know, work week. It's sort of a couple of full days, couple of half days. Now with the restrictions, we definitely had a drop-off. I think at most, there wouldn't be too many physios that didn't. A lot of it was around, I think, this initial paranoia and fear about coming out into the society. But again, similar to Dom, we had to sort of start to explore the world of the telehealth. So we have a very high NDIS patient group as well. So that was really a big push for us. I also employed 2 EPs and they haven't stopped, which has been great. So their work cover and NDIS sort of client list has been exactly the same as it was pre-COVID. But from a physio perspective, we've started to do a lot more telehealth. The uptake on that, and I think what you can do is limited because a lot of people come and see us because they want that hands-on initial kind of contact. But certainly in the last, there was probably a 2, 3, 4 week period where it was pretty slow, but certainly this week is, you know, almost, I wouldn't say it's back to normal, but it's getting close. And, you know, the future's bright, which is great. So we're sort of getting back into working long days. I was here first, I've been fully booked out today and tomorrow. And yeah, patients and people are less paranoia and fear in the community, and people that are getting injured are now confident to come out and get it treated.
Okay, yeah, that's great. So we just had a question from Hazel. She just asked, what's the main difference between an EP and physiotherapist? Because obviously you said you hire EPs, so how would they work together, and like what would be the distinctions between what you do versus what an EP does?
I'll go first, Dom, if that's okay. So basically the difference is from a physio, patient will come and see me if they have I guess an injury, whether it's a sore back. And what I tend to find I do with my guys is we first and foremost diagnose what it is, whether it's a back injury, ankle injury, knee injury, and then basically put a treatment plan in place. So we do a lot of soft tissue work, and you know, we definitely can do exercises, and we often do that. What I tend to find is when I feel like I've done my job, so when a patient is essentially close to being pain-free, they've got their range back, you know, they might sort of feel like they're in a situation where they feel pretty good. Often in some physio clinics, I think those patients often get discharged. For me, I think that's too early. So what I tend to do is I then refer them on to my exercise physiologist, and my guys offer a 1 hour, one-on-one sort of strength and conditioning essentially session. So there's no hands-on, there's no diagnosing, there's no sort of structure to it on a bed, you know, doing massage or anything like that. It's basically just strength and conditioning to try and get them up and get them back conditioned to what they want to do, whether they're an athlete, whether they're a worker. Because essentially when patients have pain, they get inhibition. So inhibition causes their muscles to become weak. And ultimately you can fix their pain, but that weakness and that underlying is there. And that basically is a disaster for that secondary injury coming along. So if we can minimize that by getting them strong and create good habits, then that's how we work together to make sure that the patient gets the ultimate treatment and rehab environment. So anything to add, Dom?
No, I think you nailed it. I think the important thing is that the good physios and the good exercise physiologists, I think they have that merger, that exactly what Nathan's talking about, that handoff process, and that understanding. We kind of talk about how our clinic is built almost in a circular nature, and they come in and our physiotherapist, exactly what Nathan says, that diagnosis, that initial part of the treatment, that organising of the plan, before there's that handoff to us where we ensure that if it's a strength weakness, if it's a motor control, even sometimes if it's a patterning issue, or we can assist with that. And then that's the whole musculoskeletal injury side of things. With an EP, we do see a lot of treatment around metabolic conditions such as diabetes, even things like cancers and stuff like that, where exercise and improving health is used for medicine. So they're the main differences. That was kind of explained perfectly. Hopefully that answers your question.
Yeah, just a bit of clarification there, Nathan. When you say they exercise physiologists work on strength and conditioning, do you mean to get to a certain point where you're capable of performing those exercises, or
yeah, I think what my guys do, and I know Dom, I've worked with Dom before. I know what they do is they usually will set a baseline and they'll have a target to achieve. You'll be setting goals. So often they'll be comparing left to right. You'll be looking at a lot of different measurements and aiming to get there. And it might be, you know, I've got a sore back. I need to be able to lift a 25 kilo pallet for a certain period of time, or from one truck to the next. So you've got essentially a patient will come to us with goals. So I can treat their back and they go, oh, my back feels amazing. But as soon as they go to pick up that 25 kilo weight again at work, they're going to hurt their back again. So essentially I can treat them, get their pain settled and their full range. But ultimately, have I done enough to say those patients should be discharged? And I think in the past, or some practices will be happy to go, yep, you're done, off you go. And then within a week or two, those patients are either back to see you with sore back pain, or they go somewhere else because they felt like they haven't had their treatment finished. So what I do with my EPs is, we sit down and actually go, right, what do we need to achieve with these patients? And like I said, if you have goals in place, you set targets, and they need to achieve those targets before you feel like they can be discharged from your care.
Yeah, I think even just to add to that, if you don't mind, one really important thing that we discuss with both my young practitioners and our young EPs is that most people have an issue where they either can't or they don't know how to do a movement. And through the planning, exactly what Nathan's talking about, you establish if they can't, they physically don't have the strength or the capacity to maintain posture through movement, or they don't know how. It's a patterning issue. They have the capacity, but whether it be due to pain or due to a lack of coordination or understanding, they don't know how. And that's where an EP can guide that, so they don't come back in the door again to see either us or the practitioners. So it's teaching someone, making sure that they physically can complete whatever they have to do to go about their life. And then they need to know how to replicate that regularly and when called upon.
Yep. And I think also, sorry, just again to add on that, I know with my guys, because they get an hour, we give them an hour one-on-one. It's not just, so if it's a back pain, for example, what the EPs will do with us is, it's not smart to spend an hour just purely on back, but it's also a little bit of general conditioning. So a lot of these patients that come to see us, they're probably a little under, deconditioned anyway, generally. So my guys will spend time with them looking at, okay, what's your main problem? Yep, got a sore back, need to work on X, Y, Z. But more often than not, they're carrying weight, especially if it's a work injury, they're carrying weight. They might have diabetes or something like what Dom said before. And so you can actually work through those things as well and actually look at when you've got enough time up your sleeve and say, right, we need to work on a global conditioning process here to really try and help these patients. So it's not just treating the problem, it's looking at the bigger picture and trying to resolve those issues as well.
Yeah, thank you for that. That was extremely detailed. So we just had a bit of questions for Rebecca. Where did you study your degree?
I studied mine at Griffith University. So, it was a master's, but that was 11, 12 years ago. So that doesn't exist anymore, but you can study it at UTS, which is a very good university. And also, I think it's University of Melbourne has a course that runs as well. And they're both 2-year courses.
Okay, that's great. Yeah. So sorry, Zoe, kind of a bit of a tangent there, but we're just asking you as a student at UTS, what is your workload like?
As a student, it's pretty hectic. It's quite full on. Because so basically orthoptics used to be a 4-year undergrad degree, and now they've shoved that into a nice 2-year master degree. So you kind of are at uni about 5 to 4 days a week. So it's quite full on, but you do a lot of practical work and all of that. Maddie's just asked me to touch on some placement. So yes, we do a lot of placement. Obviously not at the moment, unfortunately. But we do a lot of placement hours, which you start in the second semester of your first year. So basically you've got first semester to learn as much as you can about the eye and some basic testing, and then they can send you off in the second semester. So you go out, you do a couple of days at a whole bunch of different clinics. They try and get you out to as many different kind of areas. So they won't send you just to one place for an entire week and you just stay there, because different clinics focus on different things. Different clinics do things differently. So they try and give you as much information and as much kind of experience in all the possible kind of areas that you can go. Because so some are day surgeries, some have post-cataract people, some are just retina, some are just like the front of the eye, some are just kids, some are just like older people. So it's, but no, placement's been really good. At the moment, it's not happening, but we had an assignment where we have to treat a patient, and so for that assignment we've now had to try and have a go at some telehealth, which was interesting. There's not too many things you can do over a screen for your eyes, because a lot of the tests we do are big fancy machines and lots of different pieces of equipment, but try to get someone to read their vision through the screen, and was helping them make sure that they were doing their eye exercises properly. So it's got some uses, telehealth, I think, in vision, but it's in a very, very niche little area. For most of it, I think you do kind of need still the in-person kind of,
So just for some people who don't know, what is telehealth?
So telehealth is basically either using phone or video calls, or at least this is my assumption of it, like phone or video calls to give a medical kind of assessment or a sort of thing. So we try and kind of, for us, for our assignment, we tried to follow the structure as much as we could. So, we still asked them about their history, how they were going, and like what symptoms they were still having. But obviously for some of the more like physical tests that you can't perform over a screen, we weren't able to do that, but we tried to kind of gain as much information from the patient that we can, to try and help them as much as we possibly can. Like, I know telehealth would probably work quite well for kind of like post-surgery sort of things, as a lot of that is just kind of making sure that the patient's feeling all right after, say, like their cataract surgery, ensure that they know how to take their eye drops, what ones they need to have, and kind of how regularly they need to have that, because that kind of changes between, you know, 1 day after the operation to 1 week after the operation. But yeah, it's an interesting field that I think might be useful for kind of like maybe screening patients to see whether they actually need to, if what they're kind of describing as symptoms might be kind of bad enough that they might need to see an ophthalmologist or something like that. But it'll be interesting to see how that kind of works into the future as everyone kind of has a go at it and see, you know, if it'll work for kind of future things. I suppose it'll also be useful for, you know, kind of rural areas, if there's a way you can kind of, you know, kind of get out there a bit earlier, or a bit, yeah, just like a bit more, so you could kind of do a bit of telehealth maybe, and then you'd have more access or more kind of, yeah, sorry, I'll go. Stop, I'm rambling.
Yeah, that's all right. Thank you very much. I think that might have cleared up some confusion. So we'll just move on to our next question. So do you have any advice for students looking to go into your respective fields?
I think the most important thing, particularly with exercise physiology, it is a very broad field. Even just looking at some of the people I'm, again, in performance and clinical based, like Nathan mentioned, in a clinic working with that, but also exercise physiologists working in the science sector and exercise science, and researching and diving down the rabbit hole of providing in-clinic exercise physiologies with relevant studies and information. So it's so broad. I think getting a piece of putting your toe in as many different parts of the job to get an understanding of what you like, that's really important. I was lucky enough to be exposed to lots of different aspects of the job, and it allowed me to not only see what I enjoyed, but also see what I was good at. So bit of advice: don't close your mind to any opportunity around the field. As you're mentioning, Zoe, with the eyes, it's so broad, you can then specialize, but I think it's important that you don't just go in with blinders on and think, oh, this is what I like at the moment, this is what I want to be, because not only do you grow as a practitioner, you grow as a human and an individual, and that might lead you somewhere you didn't think you would. So experiencing as much as you can would be my advice.
That's great. So where did you actually study to become an exercise physiologist?
I did an undergrad degree at University of Western Sydney. And then I did another master's degree at Western Sydney. I did a master's of health science. And then just recently did a master's of strength and conditioning at Edith Cowan University.
Okay. So we'll move on to the next. Rebecca, what would you say to someone who's looking to get into genetic counseling?
To get into the course and then to get into the career, I guess you need to, as Dom was saying, sort of dip your toe into different areas and try and get some time in a genetic counseling clinic to see if you like it, because it's a pretty weird job, and I can see that there's some questions there as what is the counseling aspect of genetic counseling. So you need a pretty strong background in science, so human genetics, molecular genetics, and so you would need an undergraduate in biology and preferably some human genetic subjects. But you also need some counseling background as well. And so we would recommend that you take up some counseling subjects or try to get some work experience. A lot of the people who go into the course have done some volunteer work with Lifeline, so telephone counsellors and things like that. So I would just sort of, it's sort of really the foundations in genetics knowledge is really important through university undergraduate. And then I guess the other ways that you can come into it is with some counselling undergraduate subjects as well, or just, I guess, some life experience, work experience in counselling situations. And then, yeah, just try and, like I said, try and get as much experience, do some volunteer work, internships, and yeah, just part-time jobs any way you can. Yep.
That's great. So what about you, Nathan?
I think it's very similar. I think essentially there's so many aspects of physiotherapy, especially there's quite a lot that are unknown, and I think you need to, basically have a look, or at least dip your toe, as the other guys have said, in all of them. I think the majority of people look at physio and think sports physio. On the weekend with footy teams, et cetera, which is a fairly large part of what we do. But if you go into like a public hospital, for example, like I know through this whole COVID-19 situation, physios in particular in public hospitals, we're doing a lot of respiratory physio, basically trying to help people sort of, basically teaching them how to breathe again and giving them those opportunities to sort of, get through this. So you've got things like respiratory, neurological physio, where there's people helping, people that have had brain injuries or strokes or something along those lines. You've got women's health, men's health, pediatric physio. It's a really vast, broad, career. And you just need to, dip your toe in, have a crack at all of it. I know personally, as a sports physio, there's some amazing opportunities. Had the opportunity to travel internationally and domestically with sporting teams, and now that I'm got a family and don't want to travel anymore and don't want to get involved in that side of things, we still I love and have a lot of enjoyment out of helping some of the older population. I've had hip and knee replacements and helping those people. So it's amazing, as I've gone on in my career, my interests have changed. One of my staff who was a sports physio, she's just started to get into pediatrics, and she's just obsessed with pediatric physio and helping young kids. So I think you grow as a practitioner, and you start to find your niche a little bit. And even then, I've been doing it for 20 years, and I'm still changing and still learning and wanting to discover new things about my own profession. So I think you just got to try it all, and and that's the best way to figure out what part of the career you really want to end up in.
Yeah, so we just had a question. Would you say physiotherapy is a competitive field to try get into?
Yes, it is. I think it's very competitive. I think there's a lot of young physios out there. So yeah, in a very short answer, it's incredibly competitive. So we're in the process of looking. Probably in the next couple of weeks to a month, I'll probably look at advertising. But if you advertise in the right channels, I'd get 50, maybe 100 applicants for one position. Now, for me, that's a lot, and you've got to choose one. But it is competitive, correct? Yes.
Yeah, I think there's a lot of sports science students in here. They want an answer for that. But thank you very much. So, what about you, Zoe? You would have only recently graduated from your undergrad. What would you say to someone who's looking to do a Masters of Orthoptics at UTS?
Good thing is, so basically with orthoptics, there isn't any kind of required undergraduate study. Obviously, if you have a base knowledge in anatomy and kind of science, it does kind of help you along. But basically, all the anatomy and kind of stuff that I learned in my undergraduate, it was gone by the time it was second or third week sort of thing. Because if you think about it, we're only focusing on one structure of the body, so the eye. And if you think, I know in my anatomy course, I think we spent maybe a slide on it, if that, maybe maximum half a lecture. So, there's only so much you can kind of gain from that, and that's not going to be very helpful for an entire 2 years master's. So you do get taught everything, right from the beginning. I know we've got a girl in our course who did, what did she do? She did business and commerce, and now she's doing orthoptics. So, that's a very big kind of change, but, she's loving it and she's getting on. You obviously have to, if you have no kind of anatomy background, it is a little harder to kind of get started, but once you're started, you're on the same kind of playing field as everyone else. Yeah, I will just say, like, jobs wise, there is only 2 places in the Asia Pacific that does orthoptics. So that's us at UTS and then down at La Trobe in Melbourne. So if you are looking for jobs, especially if you're willing to go outside of Sydney and Melbourne, like, people are basically begging for orthoptists, you know, and especially if you want to go overseas. Because the other thing that we do over here in Australia with orthoptics is different to overseas is in the UK and in Europe as well, I think they mainly focus on the kind of the eye muscle side of things. So your eye turns and lazy eyes sort of thing, and your neurological sides. But over here, we also get taught about the ophthalmic side. So we get to help ophthalmologists and that kind of area of things. So like eye diseases and aging problems. So when like Australian orthoptists go overseas, we have this whole pocket of extra knowledge that their orthoptists over there don't have. So it does give you like a bit of an advantage, and, you know, it means that you can kind of go over there and they go, oh no, you know, our technician's not here to do this scan, and we can go, well, we can, like, we've been taught this, I know how to do this, I know what that is. So it just gives you like a bit of an edge over them, which I think is quite nice. So it is something that you can kind of work overseas with and kind of move around with. Yeah, like obviously if you're looking for a job in Sydney, it might be a little bit more hard, but it's, no offense to physio, but it's nowhere near as hard to find a job as that. So if you're looking for somewhere that's, you know, got a pretty good job opportunity, orthoptics is definitely one of the selling points of it.
There you go. If you're in your 3rd year of undergrad here, there's a career choice. So just moving on from that last question, just as a bit of a go ahead. How important would you guys say is work placements and getting that kind of outside of uni experiences? And is there any way like you could recommend people to go about kind of pursuing work experience, like as you say, dipping your toes in everywhere?
It's crucial. It's something that you can't avoid, particularly in our field of exercise physiology. It's the only way to go about it. I feel that the stuff you learn at university, yes, it's great. And this is not to downgrade anything we learn at university, but until you're out there doing it and seeing how it's actually done, again, the same thing, one big message that was told to me, because we treat people, not textbooks. And it's really important we have that distinction, and that how many times have we, and I'm sure it doesn't matter what field you're in, you read something in a textbook and it told you that what you were doing should be working for this person, and for that person, it's not at all. And for something that shouldn't work for someone, works. So you need to get out there. In terms of how you go about doing that, I have never rejected anyone who's requested to come in and do placement with me. If you want to come and do it, we're going to, and all our practitioners are the same. If you're willing and we're able to provide what you're asking to do, whether it be shadowing or advice or an email, rarely, I don't know any people who reject that. So how do you go about doing it? Ask is the first step. Send an email, especially with social media and everything at the moment. Just get out there and ask. That's how I got, I work with a company called Exos and talk about traveling. I just sent an email, and that's how that started.
That's really good. So what about you, Rebecca? You've got a bit more niche field.
So do you mean work experience before getting into like the master's course, or just?
I guess it would be more like if you were looking to get into the field, but you maybe haven't quite gotten into the course yet, and then also like if you are in the course.
Yeah, so if you're not in the course yet, I guess we don't get a lot of undergraduates approaching us for work experience. It's quite difficult because genetic counselors generally, I would say, work within a hospital setting. And so you would have to sort of come in a volunteer capacity, and that would have to be all set up through the hospital system. So it is a little bit trickier just to sort of come and do some placement or work experience or volunteer work. But it's definitely doable. And we've definitely had volunteers without any experience in the past. But it is a bit of a process to get into the hospital systems, because very few genetic counsellors would work in private practice. And then once you're in the course, there's a lot of opportunities. So there's clinical placements throughout, except for now, which is terrible. But anyone that's on clinical placement, I will just say to them, can you continue and volunteer with us 1 day a week? And it's kind of just doing like data entry and stuff, but then we'll give them exposure to cases and calling patients and things like that, which they really enjoy. And then that way they sort of expose to the profession, but we're also exposed to them, and they seem to be the ones that tend to get the jobs, because their face has been around a bit more. So there's the volunteer opportunities, and then there's a lot of what we call intake officers in clinical genetic services. So they're just basically sort of second year students that tend to come in and we'll do all of like the patient phone calls ahead of time and gather information and things like that. And that's a really good way to get some experience and onto your CV as well. So yeah, they would be the main ways.
Yeah, that was great. So what about you, Nathan?
Similar to Dom, I think, like personally, I wouldn't employ anyone that hasn't done any form of work experience or internship at all. For me, I think, and I'm probably speaking for a lot of my colleagues, when you're getting, as I said before, such a highly competitive field at the moment, and a lot of graduates, I'm looking for someone that wants to go out above and show me that, they're prepared to do more than anyone else. So for me, the obvious starting point is to do things like weekend sports coverage with the local footy team. So we look after a lot of it, and I get probably 10 emails a year, or people contacting me, students, third, fourth year students, final year students, saying, can I come and help you? And what they basically do is they'll come along. Sometimes they'll be on their own, sometimes they'll be with one of us, and they help strap ankles and just shadow, like Dom said, shadowing you, learning and asking lots of questions, and I guess seeing what we do, and that helps them sort of drive that decision process. Is this the area they want to do? Is what they're interested in? So we take students. I'm a clinical educator for Sydney Uni, but I think we've got a UTS student later this year. So people touch base with us and will email us and just say, can I come and do, because most of the physio placements are 5 weeks. So we take them, and I say to every final year student that comes to my practice for their placement, treat this like a 5-week job interview. Like I've employed many new grads before, and the only new grads I've ever employed have been ones I've had as students, because you see over the 5-week period what they're like, and what their work ethic's like, what their personality's like, and it's an opportunity. So if you get an opportunity to do work placement, then that's your time to shine really and show what you've got. So for me, I like to see that the new grads and the students are going above to show that they really want to be interested, and that also shows me that they're prepared to work hard. And like I said, I wouldn't employ anyone that hasn't done something like that.
Yeah, that's really good. So what about you, Zoe? What would you say to an undergrad looking to maybe not try orthoptics, but find out more?
I would definitely suggest, like, if you can somehow get into a clinic, it might be interesting to kind of find out what an orthoptist is, because I know, me included, and probably quite a few people in my course, none of us really quite knew what we were getting ourselves into when we signed up for the course. It was a bit of a kind of, we've heard the points of kind of what orthoptics is, but you don't quite get an idea of what it actually is until you finally get to go out and do placement. And because it's a field that's quite small and niche and not many people have heard of it, it's not like you can kind of think and go, oh yeah, I know what that job would kind of be like. I know kind of, I've seen that before. But yeah, like if you're kind of interested and not sure if it's kind of what you want to do, I don't know. I don't know what other clinics are like, but I know most people seem to come into it blind, and we're all doing all right and kind of enjoying it, which is good. So but I suppose that's kind of one of the problems with one of those kind of like niche areas, is it's not quite as well known. So those kind of less exposure to kind of what you might be doing. I know a lot of times I say orthoptics, people think I'm talking about feet, so that's kind of my goal at the moment, is try to get everyone to think eyes when they hear orthoptics. But yeah, it's I suppose if you show that you're kind of interested and you really want to kind of show that interest, it's really up to you and kind of how much effort you're willing to put in for for the degree really, and for the job in the future.
Yeah, thank you. So I think in summary, what everyone's saying is you guys all need to be proactive. You all need to try your best. You all need to make an effort, most importantly. So these opportunities, I'm pretty sure they don't just grow on trees. You have to go out of your way and do it. So I think that will conclude our formal questions. So we're going to move on to our Q&A sessions right now. So we're just going to ask everyone to...
Sorry, I just thought of a point, just from like a student's perspective as well. We get a lot of guest lectures that come in. So it's kind of in while you're in your masters, but if you kind of, make sure you're answering the questions when the guest lectures come in, and really kind of get a rapport with them, because they're people that have come in from out there, they're the top in their field in that kind of area. We have ophthalmologists that come in. So if you kind of show yourself and show that, you're keen and interested, they will remember you. Like, I've had a guest lecturer that came in and we saw him later on, like a year later, and, he still remembered me as the one that answered his questions. So I'd like to think that means something for me in the future. But, it's just helpful to kind of, anyone that's professional, if you can really just try and show them that you know what you're doing and that you're interested and you came.
Yeah, I think that's really good advice for any undergrads here. So yeah, just going back to what I was saying is we're going to move on to our Q&A session. So this is where everyone's going to be able to say any questions that I didn't quite cover, but we ask you to please only try not to talk over each other. You can feel free to unmute your mics, but we ask, please don't try to talk over other people. We'll try to get to as many questions as we can. So if anyone's got anything to ask to a particular person, feel free to speak up now or put it in the chat, and we'll direct that person to you.
I think that a big question was in the chat before to Dom is, what is the required study before doing a kind of a master's course? Do you need a lot of science knowledge? Is it more anatomy based? Should you have experience in like exercise or PT or anything like that? Like what kind of, what would be a good starting step now in undergrad to be better prepare you for a master's?
I think now that it did change when I was at uni. I was the last group that went through under the old system, where now you can do undergrads in sports science and strength and conditioning and even education. I think they allow before you go into the 2-year masters. And I think to a point someone else asked about the similarities in the courses between what EPs do and what physios do. Again, there are base anatomy, base physiology, and we don't go into much depth of what physiotherapists do, of course, because like Nathan said, if you kind of look at the way we treat people, there's a certain side of the spectrum that we work towards. So a lot of the education is around that side of the spectrum. But we have to understand, so yes, there's a lot of science. Is there enough in the course at the moment? When I went through, probably not. I had to go continue education and go do other degrees to try to develop that myself. Even listen to Rebecca and that understanding of counselling. I think it's such a huge part of what EPs do, and physios, I'm sure Nathan would agree, is that counselling aspect. And I think that's something that is very low in our degree. There's not enough, we didn't know anything about that while we're doing that. So I hope that answered the question.
Yeah, awesome. We have another question in the chat. Zoe, what was the Orthoptics interview like? Is it an interview in every master's course? Do you know?
I'm not sure about all the master's courses in the Graduate School of Health. I'm assuming they might, but I know for orthoptics, it's very much, there's one thing coming in with good grades and, looking good on paper, but, if you can't interact with people, that's going to be kind of part of your whole job. So the interview, I know from like the academics kind of perspective, is very much about you know, do you know about orthoptics, or have you just kind of turned up and gone, oh, I didn't even look into it? They want to see that you're kind of interested, that you've looked into it a little bit, and that you have kind of people skills to work with patients, you know. If you're quite a shy person and don't really interact a lot with people, and you kind of like to be kind of behind the scenes, then maybe a patient kind of sort of role isn't for you. But yeah, it's just kind of to make sure that you're a people person and, you know, you're going to be able to actually do the job at the end of it.
I think that's with all the careers here tonight. I
think
putting people first and having good, strong interpersonal skills. We have a question for Rebecca specifically, but for everybody. How is it hard? Like, do you find it difficult saying goodbye to patients or clients? How do you not get emotionally invested in people's outcomes? I know, like, I've worked with Dom, you have a patient for a long time and you can get quite connected to them. What's that like?
So in genetic counselling, and there was a question that kind of links into this further up, was sort of what is the counselling and how much does the job involve continual care and counselling? And so basically in genetic counselling, they are kind of brief relationships, and you're really kind of getting them through. They're coming, I guess, example in my field is that they're coming because of a high risk in a pregnancy, or there's something going on in the family. So we need to get to the bottom of that through genetic testing and making choices and things like that. So the relationships are quite brief in terms of maybe a couple of weeks or so that we're dealing with these families. In terms of what the counselling aspect of that is, well, yeah, there's all of the explaining genetic testing, facilitating testing, explaining results and everything. But the counselling aspect is not really therapeutic counselling, like long-term therapeutic counselling. It's more just supporting people through really difficult times with decision-making, providing options and informed choices. And then also when, I guess in the worst case scenarios in my area, when there's terminations of pregnancies or pregnancy losses, you do support women and couples through that time. But there's sort of a cutoff where then you would hand them over to, I guess, social work or a psychologist to provide that ongoing support. So at the start, and I do get attached to patients emotionally, and it can be difficult, and you do get some emotional burnout. But I don't know, I'm pretty good at cutting it off and saying goodbye. So I'm a bit harsh like that, but you kind of have to be a bit like that to be protective, because otherwise, yeah, you're going to take a lot of stuff home with you. So it's see you later kind of thing.
Looks like Nathan and Dom can both relate to that. Struggles, yeah. Another question for you, Rebecca. What are the job prospects like and opportunities to work overseas in genetic counselling?
I think they're quite good. Just genetic counselling in general, when I first started, there really weren't that many jobs over there. I was quite lucky, but I did have to move to Tasmania to get a job. So you have to be pretty flexible. You have to be open to sort of taking part-time jobs to get your foot in the door, and maybe in areas of genetics that you're not quite into. In terms of job prospects overseas, I do know that there's quite a number of genetic counsellors that have graduated here and moved overseas. So Singapore, US is kind of tricky. UK, there's quite a number of Australian genetic counsellors in the UK. So yeah, so there are opportunities overseas. There's different, I guess, it would be in other fields as well, registration. So you kind of need to look into that to see whether Australia is the equivalent, and in the US they're not. So it would be difficult to get a job in the US. Canada may be a little bit easier, and the UK is similar to us. But yeah, there's definitely jobs out there, and a lot of, and just in job prospects in general, these days, genetic counselling, the field has just gone so wide that genetic counsellors sit in a lot of different disciplines, not in the traditional role of just being in a clinical genetics service. So as I'm sitting in a fetal medicine department, the genetic counsellors are sitting with neurologists and cardiologists and laboratories and things like that. So there's a lot of different job prospects out there now. You just have to be a bit flexible. Yep.
Probably a good question for Zoe. Did you feel much anxiety going into your first placement, as it's such a new thing in the master's course?
Yes, very much. Because you know, you feel like you're kind of almost getting thrown in the deep end. And I kind of did, because my first placement day was at Royal North Shore Hospital, and the orthoptist that works there is very well known for kind of letting you fly.
Yeah.
But it was also very great, because it was kind of almost reassuring that someone was willing to let me actually, you know, do some tests on patients and not just kind of observe. Although a lot of placements do, a lot of the private practices unfortunately only let you observe, obviously because their patients are paying, so they expect a certain level of care. But especially in the hospitals, like on your first kind of few, you know, you get to kind of go and do whatever you like, not really, but like under the guide of the orthoptist there. So yeah, I don't know, it was really nice. I really enjoyed my first placement. You get there and you're really worried, and you're like, I don't know anything. Why are you going to let me do anything? Like, I don't know what I'm doing. And, you know, by the end of the day, you're like, oh, I've actually learned something over the last 6 months, and I kind of do know what I'm doing. You know, taking vision really wasn't that hard. It's just reading some letters, which is something you can kind of, because you can kind of work yourself up over all these little tests that you've been learning and practicing and you've been examined on, and, you know, and then you go, well, I don't know how I'm going to do this on a real patient. I've only ever done it on my friends.
You'll get
yeah, no, you kind of really settle down. And every time you kind of have a break from placement, the first time you go back, you're like, I've forgotten everything, don't know how to deal with a patient. And the second you step in there and you say hi to a patient, it all comes flooding back. And yeah, and then it's always nice having your supervisors there, and you know that they believe in your skills, and that they think you're competent enough to actually work with a patient. And even when they kind of start leaving you on your own with the patients, that's like another kind of confidence boost, that, you know, they believe that you're capable enough and you will do a good enough job to qualify, you know,
yeah,
do it on your own, which is nice.
Awesome. I think that's definitely relatable to all fields.
Even on that point, Maddie, sorry to just
That's
one
okay.
really big thing that we noticed with a lot of our students, and it's hopefully you guys can, a nice take-home message, but it's really important that when you come to a placement and you're straight out of university, we don't expect you to know everything, and it's okay not to know everything. So that's one thing to not be nervous about, your clinical knowledge and knowing that. One thing that you can focus on is just being the simple things, being polite. The things that Nathan's talking about, personality things where, yes, you're nervous about doing that, but if you come there, we're never going to hire anyone who we don't think is a good person. So that can de-stress you a little bit. Don't stress so much about, I need to know everything. If they quiz me, I need to know all the answers. Start off by being a really respectable person who is ticking all those boxes, and that can kind of get your foot in the door. Exactly right. Be on time, all the simple things. Be enthusiastic, be pleasant to talk to, be polite, all the simple things that can go a long way. The clinical side of things will flow on as you go through the practice and, the work experience, but all those simple things, you can't underestimate them. They're huge.
Yeah, thank you for that, Dom. That's really, really interesting and quite good advice. I think our last question will be, we'll aim this towards you, Nathan, because you spoke about the NDIS before.
Yep.
Would physio be the only right career path? Or is there different career paths? I know there's occupational therapy. Is it
OT, yep.
NDIS? So if you want to speak about how physio works with the NDIS, and then Dom, you could touch on that as well, and everybody.
Yeah, so we within our practice of a large NDIS, we're, like I said before, we have access to big hydrotherapy pool in my clinic. So that's a huge part of our NDIS program. And so us as physios, we will not only do one-on-one with our NDIS patients, whether it's soft tissue work, you know, anything that's required, but we do stuff in the pool. But our exercise physiologists are equally, if not more important in that role as well. So our EPs have a huge part of our NDIS program for sort of that activities of wellbeing and daily living. So more often than not, they're in the pool one-on-one with these patients as well, looking at everything that we're looking at. So it is absolutely a team effort between myself and my EPs. I don't have any occupational therapists, but I work very closely with a couple. We work back and forth, and often that's around things like what they have in their home space, making sure their home setup is accurate. You know, we obviously work closely with everyone from case managers, psychologists. So the disability field, I guess, so to speak, is just huge. But certainly for us, that we have a huge involvement in them, but we work really closely. It is very much an allied health team that works together with us, along with often GPs, specialist doctors. Plus, you've got carers, you've got the parents. It's a massive responsibility that we take really seriously. But it's an area we've been doing it for about 2 years now, and I can honestly say it's one of the most gratifying and pleasant experiences, because people, there are some patients that came in wheelchairs that are now purely completely disabled, but they're in the pool, for example, walking in the pool. They won't walk up on land, but they're doing things like that, and it's just great to see. So the NDIS program is changing people's lives, which is fantastic.
Okay, that's awesome. So we are running out a bit of time, but I did we have gone a bit over time, so we'll have to stop the questions there. But I just wanted to refer everybody the Graduate School of Health at UTS has a Facebook page and an Instagram, and they post a lot of information evenings. So I would recommend going to that. I know as a third year student myself, last year I went to the postgraduate welcome evenings, and you can ask a lot of questions to their teachers and professors. That's usually held in about October, but they also have an email that you can contact. It's gsh.future@uts.edu.au, and you can email them with any of your specific questions, and we'll send up a follow-up email to you guys about if you want to reach out to these guys in our panels, how you can contact them through their various workplaces as well, and you can always ask direct questions there. But yes, thank you. I'll hand it back to Daniel to do a quick wrap up.
So huge thank you to everyone who came. I'm sure this is actually nice to be on Zoom but not doing work. But I hope everyone learns a lot. I know I learned a fair bit about all the different fields. Huge thank you to all of our speakers, Rebecca, Nathan, Dom, and Zoe. I'm sure you guys had fun as well. Helped a lot of people here too.
I just wanted to say as well, a massive thank you to all the speakers that took time out of their day or their evening to do this. I'm not in the allied health space at all, but I definitely learned something about each of your respective fields, and I'm now considering a career change to orthoptics if there are so many jobs. So yeah, thank you. It was really, really interesting to hear from all of you. So thanks for that. I also just wanted to let you guys know that MedSoc are also running another Job Truth on the 21st of May. So keep an eye out for that. And yeah, we'll also be sending through like a post-event email. And I would really personally appreciate it if you could fill out the survey, because it really just helps us to make these events better for students. So, but yeah, thank you everyone so much for coming.
Thanks, guys.
Thank you guys.
Thank you.
So
See
much.
everyone. Good night.
Bye.
Thank you.